Today, we're really lucky to have Dr. Rebecca Flower. So Rebecca is an autism CRC researcher based at Trobe University. Rebecca has been quite involved with some of the longitudinal studies. Now, longitudinal studies just simply means studying individuals over time, so often across months, if not years, which is a really important thing because, of course, we can only really understand so much about an individual if we see them once. It's really important that we see people multiple times. What these longitudinal studies allow us to do is to explore changes in a person's development and outcomes over an extended period of time. So Rebecca today will be giving a brief overview of this particular study and what we found about the experiences of young autistic adults as they transition from school to their adult lives. We'll have Rebecca have a bit of a chat now, and then we'll go back to Marina afterwards. Over to you, Rebecca.
Great, thanks, Andrew. I'm hoping you can see my screen now. All right, no one said no, so I'll assume you can. Wonderful, thanks so much. Okay, so thanks so much for having me today, guys. I really appreciate it. Like Andrew was saying, I'm Beck Flower. I work at the Olga Tennyson Autism Research Centre with Associate Professor Amanda Richdale, Alex Haschek, and Dr. Lauren Lawson, who I'm covering as the postdoc on this project while she's on maternity leave. So we'll be talking about young adults on the spectrum, so it aligns quite nicely with what Marina was saying. And let's see if I can go to my next slide. Oh, technology. There we go. Success. Okay, so I thought I'd give you a quick overview of what I'll be talking about today with regards to our study. So first I'll start off with the why. So I'll give you a quick overview of the knowledge regarding autistic transition age youth from what we knew prior to conducting the study, highlighting why the SASLA study was really needed. And then I'll go on to the how, so how we're conducting the study at the moment and who's participated and what we've found to date. So I'll start off with the why. So we know that transitioning out of high school and into employment or higher education can be really challenging for anyone, but it can be particularly challenging for autistic transition aged youth, which aligns really nicely with what Marina was just saying with the case study she gave of that young individual. And I've met a number of young individuals just like that gent she was speaking about. So we know that those on the spectrum often experience social challenges and adverse events like bullying at school or in the workplace. We know that individuals on the spectrum often experience challenges beginning and maintaining higher education, which may have something to do with, I put there, a lack of structure. So there's a lot of structure and support in school, and that kind of drops away. There's a lot of questions about what the future looks like and what higher education actually looks like and what getting a job looks like. We know that people on the spectrum face a number of barriers to gaining and maintaining employment, and this is really my passion. I've worked in this area for a while, and I've met so many young adults who would just make bloody great employees, but really face a number of barriers to getting a job and maintaining employment. We know that young adults on the spectrum often experience mental health challenges, and we know that they often experience co-occurring conditions like, say, epilepsy or ADHD. However, we don't have a lot of data in the Australian population, so we would like to know what's happening for Aussies on the spectrum. Sample sizes are often small, meaning we don't really know sometimes if the sample size is small, if the challenges are just relating to that sample, or if we can generalise and say that it relates to everyone. And there often isn't a comparison sample of non-autistic individuals. So that means it might be a problem for everyone, not just those on the spectrum, but if we have a comparison sample, we can see if it's just a challenge for those on the spectrum or more of a challenge. Therefore, the SASLA study is really useful. So we're having a large cohort of autistic and non-autistic individuals that we can compare on a whole range of different areas. Even better, as Andrew was saying, a longitudinal study means we can look at some things at one time point, but we can also look at things over a different times to see how they change. And that's why this study is really useful. So onto the how, so how we're conducting the study and who's participated so far. So it is an ongoing study. We've finished recruitment, but as it's longitudinal, some of our participants are still completing the second and third time points. So the SASLA study, sometimes I say SALSA, the SASLA study is an online survey-based project which follows young people aged 15 to 25 over a 2-year period. So they complete data collection at the first time online. It's all online, so you can do it in your own home. Baseline's just the first time you complete the study, again at 12 months and again at 24 months. So we have a few different samples. We have our autistic individuals. We have a group with and without a co-occurring intellectual disability. We tried to recruit a larger proportion of individuals with a co-occurring intellectual disability, so our sample was more representative of Australians on the autism spectrum, but we do have a smaller group. We found that group a little bit challenging to recruit for the research. We do have a group of non-autistic individuals without a co-occurring intellectual disability in the same age range, and we do also have a sample of parents and carers. So prior to conducting the study, the team engaged in community engagement. So they spoke to a number of autistic adults, organisations working with autistic individuals and family members, carers, partners, friends, to talk about what they thought were important for us to really look at in this study. We also consulted the research literature, which of course we do as researchers, to see what we knew, what the gaps were, what really needed to be investigated a bit further. And there was also an advisory group established throughout the study. And this is really important, as Sam and Julianne will speak to today. It's really important that we work alongside our autistic individuals in conducting research and interpreting and translating research. We are currently changing up our processes working with our advisory group and funding our group. And so we look forward to working alongside them more. So the study's really broad. We look at a whole bunch of different areas. So we start off with demographics like sex, age, living situation, relationship status. We look at education, employment, autism symptoms, mental and physical health, well-being, non-autism specific traits like emotion processing, and developmental and adaptive behaviour. In terms of who's participated, at baseline, we stopped recruiting for baseline July last year. We had 117 autistic adults and 221 non-autistic adults. So this is just the autistic individuals without a co-occurring intellectual disability. And that's pretty good. A lot of autism studies have quite small samples, so this is quite a large sample comparative to those studies. At the 12-month and 24-month time, you can see a lot of our autistic cohort have completed their data, and some of the non-autistic individuals have, but like I said, that's still ongoing. So we hope to see those numbers improve. People do tend to drop off participating in research over a long time, but we hope that our numbers will continue to increase, and we certainly have a long period of time until we expect that to stop. So I'm looking at my time, and I'm glad I've left a lot of time today to talk to you about what we have found so far. So I'll be speaking about the baseline data collection, because that's where we finished collecting data just for those autistic individuals without a co-occurring ID and the age-matched non-autistic individuals from the baseline time point. In terms of sex and age, we found that there were more females in the non-autistic group and more males in the autistic group. This aligns a little bit with what we know about the sex distribution among individuals on the spectrum, but this is changing. Nonetheless, there is a sex difference there. There's not much of an age difference though, which is great. So both groups were 15 to 24 or 25, and the average age for both groups was 19 with a standard deviation of 3, meaning the distribution is nice and similar between the two groups, which is really good for comparative purposes. In terms of age of diagnosis, it was 9.6 years was the average age of diagnosis, which is quite high and not ideal. As we know, the younger an individual is diagnosed, the better we can understand what their support needs are and those needs can be met. And only 15% of our cohort were diagnosed at 3 or under. So this is just the autistic individuals without a co-occurring ID. The standard deviation was also about 5.5, so which just means that there's quite a large variation in the group on where they were diagnosed. So it'll be interesting to delve into that a little bit further as we conduct data analysis. So school experiences was one of the areas where I wanted to highlight today to give you a little bit of an overview of what we found. With regard to adverse outcomes, so for example, those who were suspended from school, we found no difference between the two groups. We found that both groups reported finding school a challenge, but both groups also reported finding school enjoyable to the same level. There were differences between the autistic and non-autistic groups with regard to liking classmates, with the non-autistic individuals reporting liking their classmates more. And with regard to the experience of bullying, with the autistic individuals being bullied more often. So it was quite high among both groups, but it was significantly higher among the autistic group. When we broke it down to different types of specific bullying, like teasing or physical attacks or aggression, there was no difference between groups. So this is alarming, but it would be interesting to break this down and see what's happening for our autistic cohort. I thought it would be useful to include some quotes from the autistic respondents about what transition support they found quite useful. As Marina was saying, this is a really challenging time for kids on the spectrum. And I thought that these really came down to insight and clarity and like transparency about the future and having someone to ask questions to. So for example, information on how to apply to university. As a first in family university student myself, I found uni can be really hard to understand how to do everything. And it seems like this is perhaps more of a challenge for those on the spectrum. I also thought it would be useful to include some desired transition support quotes. And again, I thought this came down to transparency about the future, having some information presented in a clear manner, having someone to ask questions to about these processes to give some insight. And then some people have also spoken about how it would be useful to have a better understanding of themselves and their needs. If you didn't get all of these now, this will be recorded so you can access them later. Post-school education was an area I wanted to touch on as well. So we found that more autistic individuals reported attending TAFE and more non-autistic individuals reported attending university. I thought that's really interesting, and it'll be really interesting to investigate this group. I'm not aware of this, having seen a stat like this before. Interestingly, a few were engaged in online learning, although note that in the face-to-face courses, there's often an online learning component anyway. And I included a quote here that aligns really with what I was saying, and what seems to be my feel from the data so far is that someone said they would have liked support in the form of what to expect. So the differences between university and TAFE and high school would really help prepare that transition. So about, again, transparency and clarity. In terms of employment, so just looking at those who had left school, same as the past slide, autistic individuals were much less likely to be employed than non-autistic individuals. These rates were close to what the best estimates we've got at the moment, which are from the Australian Bureau of Statistics, and they suggest approximately 41% of autistic adults are employed. Our data was less. It was a bit lower for both groups. We did find that it may have something to do with the age, so it may be harder for young adults straight out of school to get a job. It'll be really interesting to look into this data and see what's going on. But looking at some of our qualitative responses, some people have said things like this quote here, that they thought it was because of their anxiety and Asperger's syndrome and a lack of awareness and understanding among employers. And having experienced, I used to work for a not-profit, helping people, employers understand autism and hire autistic adults. This really aligns closely with what I've seen out there, is that there's a long way to go in terms of employers having a good understanding of autism in adulthood and employing autistic adults. So we hope to see this change over time, and hopefully this study can inform where and what needs to be changed. In terms of mental health, both groups reported mental health challenges, which is common among individuals with and without autism. We found that autistic individuals, however, were more likely to report current anxiety and depression, which does align with what we know among adults on the spectrum, that these are challenges faced quite frequently by autistic individuals. We did find in our sample that autistic individuals were more likely to be taking medication for mental health challenges, so this does indicate at least that support is being sought, which is great. In terms of physical health, sleep difficulties were reported by over 50% of both groups. So both were experiencing quite a high level of sleep challenges. There was no significant difference between the two groups though. We did find that autistic individuals were more likely to have visited a dentist, doctor, general practitioner, or had other health checks in the previous 12 months. So at least our autistic cohort did seem to be getting support and seeing practitioners, which is a good thing. And here I included a quote from one of our participants who said they would have liked training in life skills. So cooking, cleaning, time management, finances, how to make friends, maintain friendships and relationships, and preparing living away from home. Again, it's about what is happening in that future. And I guess, like Marina was saying, what is the big picture? Because often that's just not clear, and particularly not clear for those on the spectrum. I really look forward to her talk. If you'd like to keep up to date with SASLA, we love to keep you up to date. So we send out quarterly newsletters. We include what we're up to, where we've been, any studies we're recruiting for. We've recently created a snapshot of the SASLA baseline profile. And we include links to papers we publish, so we really try to keep you in the loop. So please email at sasla@latrobe.edu.au. If you've got questions, I'd love to hear them. Please do email me anytime at r.flower@latrobe.edu.au. Thanks so much.